Good afternoon. I'm Michaela Miller with a Monday edition of the Out City COVID-19 News Show. Today is Africa Day, an annual commemoration that celebrates the foundation of the Organization of African Unity, which was established on the 25th of May 1963. It was remodeled in 2002, becoming the African Union. Later, we will play the AU anthem, but right now, let's see what's coming up in the news. President Ramaphosa came to brief the nation last night. Hero in My Hood donates books to the Children's Art Project, and sex workers say the government is not supporting them. And the Western Cape Health Head of Department, Dr. Keith Kluter, gives a lockdown of the COVID-19 pandemic in the province. As the lockdown continues into day 60, the current number of COVID-19 cases nationally stands at 22,583, with 11,100 recoveries and 429 deaths. In the Western Cape, there are 13,969 confirmed COVID-19 cases, 6,950 recoveries and 300 deaths. And now for the news. While the South African Democratic Teachers Union has called for teachers across South Africa not to return to work, the union's members in the Western Cape were locked in talks on Sunday night over the reopening of schools. SADTU in KwaZulu-Natal, Gauteng, Northwest and Limpopo have publicly urged members to refuse to return to work. Basic Education Minister Angie Motshekga said teachers should report for duty from today to prepare for grade 7 and 12 pupils who are scheduled to be the first group phased back into the classroom on the 1st of June. We spoke to the Western Cape SADTU Deputy Secretary Sibongile Kwazi.
Yeah, as a union, we feel that WCED is not ready to receive teachers and learners at school, and we feel that they are rushing into this ill-prepared. Hence, we have, as a provincial executive committee, we took a conscious decision and a resolution yesterday that our members must not let themselves be sacrificial lambs in this thing of reopening of schools. So we have informed our members not to report for work. Our call to the employer is that they must get certificates from the Department of Labor to confirm that our schools are ready to receive both teachers and learners. So once those certificates, those compliance certificates are in place, we won't have any qualms with regards to our members going back to work. Our teachers want to go back to work, but we want to go to a safe environment. And our belief is that the employer is responsible for the safe environment for teachers to work in. No, we've been in constant consultations with WCED, and most of the schools did receive the PPEs. But our challenge is with regards to screening of educators and learners when they come back to school, as well as now the cleanliness of the schools. You must remember that there are schools with only 3 cleaners for the entire school, and we are told that surfaces must be cleaned every 2 hours, which means that the staff that is there, for instance, is not sufficient to carry out that job as of now. And also with regards to screening, because what the National Minister of Education has indicated is that there should be people, health officials who are screening educators. But in the Western Cape, the stance is that teachers must screen each other with regards to this COVID thing.
Western Cape Premier Alan Winde is celebrating President Cyril Ramaphosa's decision to move the entire country to lockdown level 3 from the 1st of June. But Winde also warned residents to adhere to regulations in order to keep safe and save lives. The province has the highest number of coronavirus infections, which had led to speculation it would remain on a higher level of lockdown. Winde said things would get worse before they got better, reminding South Africans to work harder than ever before to slow down the spread of the virus.
The Western Cape government welcomes the announcement by the President that we will move from alert level 4 down to alert level 3. This is in conjunction with targeted hotspots, a plan that we have been putting together for a while now. These targeted hotspots will utilize a combined effort from all levels or spheres of government, along with civil society, to make sure that we limit the spread. We are taking this very seriously, and simply put, things are still going to get worse before they get better. We cannot stop now. We need to work harder than ever before to slow the spread of this virus. We need to make sure that business as usual is not what happens moving into level 3. We need to make sure that we change our behavior to keep safe and save lives. Every single one of us have a role to play in this regard. When you keep yourself safe by wearing your mask when you're in public, by keeping your distance, or by following the golden rules of hygiene, and by staying home as much as possible, you keep your loved ones safe too. While most people in the province will recover after being infected, some of the people we love the most, who might be older or have underlying health conditions, may not. We must change the way we live so that we can protect them too. I know that if we all work together in this way, with a common goal, we can get through this difficult time with our province and our country. The responsibility is on all of us, and it has never ever been greater. So please keep safe and keep us, or help us, to save lives.
Elderly people living in frail care homes are particularly vulnerable to COVID-19, as has been seen around the world. Now the Ikaya Lokolo Lays Frail Care Centre and Home for the Aged in Gugulethu is being evacuated following the positive diagnosis of 2 patients and at least 4 staff members. IOL reported that it was not yet clear where the 94 residents will be placed while the facility undergoes deep cleaning. Healthcare workers across South Africa have complained about risk to their health. Director of Samson Institute for Aging Research, Leon Geffen, said it was the duty of the Social Development Department to urgently capacitate facilities with adequate funding and proper protective personnel equipment, or things would get worse. A recent study by Statistics SA has revealed that almost 9 out of 10 respondents who were employed before the lockdown were still employed, but 5% of respondents said they were concerned about the long-term impact of the COVID-19 pandemic on their futures and income. Stats SA reported that a future 25.8% of respondents said their income had decreased during the national lockdown, while 56% said their income had stayed the same. The Western Cape Head of Department Designate for Health, Dr. Keith Klutter, recently delivered a presentation in which they tabled the province's response to the COVID-19 pandemic. Here is some of what he had to say.
So the current status of the epidemic in the Cape Metro, we have a rapidly increasing epidemic with increases in hospitalization and in deaths. The Premier has referred to the fact that we've gone over 200 deaths. We are on the upward part of the curve, which is the nature of the pandemic. So we're truly in the uptake of the epidemic phase in the Western Cape, specifically in the Cape Metro. There is concentrated in these clusters that I just spoke about, care homes, and in the geographic areas where the workers live, which I illustrated to you, which is mostly in the most vulnerable communities in Cape Town. So our hotspot intervention, therefore, is prioritized in these geographic areas. At the same time, our testing and our lab capacity is under severe strain. and there's been very well documented over the last two weeks, the big backlog that we're experiencing, not only in the state laboratory service, but also in the private sector laboratory service. The facilities to isolate and quarantine offsite are being scaled up. We're bringing more and more facilities online, but the limits of this available capacity will ultimately be exceeded. There are a large number of undetected cases, which will continue to grow because of the limitations of testing. So as we have found more and more tests, more positive cases, there are more and more positive cases. But because testing is a limitation, we will not be keeping up detecting all the new cases as they grow. That's also not unique to our situation. It has been repeated elsewhere in the world. The ability to continue with individual case detection and contact tracing is therefore being stretched by the sheer numbers of new positive cases and their contacts. If you look at the current status in rural districts, it is a slightly different picture. The Cape Winelands district is showing evidence of multiple clusters and faster spread, having started in Witzenberg 3 weeks ago, and it's now moving on to Drakensberg, Stellenbosch, and Brede Valley in the past 2 weeks. So there is emerging clusters, and it will probably be fair to say that Cape Winelands in many places are similar to where Cape Metro was 4 weeks ago in terms of these emerging clusters. There's also earlier clusters in Overberg, in Theewaterskloof, Swellendam, and in West Coast in Swartland during the past week, while there's still many areas with no cases or only very limited cases, or cases that was completely have recovered in the rest of the province. So it's not the same picture everywhere in the province. The testing and lab capacity strain is impacting on these rural areas to detect cases earlier and to move to isolation and quarantine, because it's still a very effective intervention, but they are also hamstrung by the same testing and lab capacity strain. The ability to isolate and quarantine offsite will be scaled up rapidly across all the rural areas, and our Department of Public Works is bringing that online together with municipalities very quickly. There's projected to be a smaller number of undetected cases, and therefore aggressive testing is still indicated in the rural districts. And there's still very big value in individual case detection and contact tracing to contain the spread in those specific areas. But let's come back to the Cape Metro. The fundamental issue we want to put on the table is to say that we propose something called a risk-stratified case management approach. And it is at this point in time that we're saying we want to turn our attention to the most vulnerable people. And I will explain the definition of vulnerability, because we're saying now we want to take a dedicated focus to find the most vulnerable people. And if I go into this, we're basically saying of all cases, we really want to get into the mode that people that are generally going to contract COVID, that become symptomatic, needs to know when to seek help, but also needs to know how to self-isolate and how to manage their own symptoms, because by and large, 90% of people will recover. But also of all our known cases, the ones that we've diagnosed, many of them are at lower risk. And again, we can give them the advice, self-isolate, self-medicate. If you need advice, call us and we will help you through how to do that.
It's time for a break, but when we get back, we will be looking at how the lockdown has affected sex workers, the highlight of President Cyril Ramaphosa's nation address, and more. Stay with us. Welcome back. You're still watching the Our City COVID-19 show on Cape Town TV. Hero in My Hood, an independent publisher that equips children with reading materials and educational activity books, has donated 200 books to the Butterfly Art Project's Art Kit collection for children and is calling for sponsorship for more. Co-founder Mandy Lomberg said creative and artistic activity could soothe jagged nerves, ease tension and help heal troubled minds. It was also a way to alleviate the stress and boredom of the lockdown. This is what Lomberg had to say.
Hero in My Hood is a company of two people. And what we believe is that children need to be heard. Children need to be encouraged to become heroes of their own neighborhoods. Hence the name, Hero in My Hood. And we're about encouraging children to be courageous and to be kind. So what we do is we make children's story activity books. So they're books that are stories and activities all rolled together into one. And we have positive messaging. And as I say, they're story and activity books. So for instance, here's one of them. It's the story and there are activities inside as well. So the kids have got lots to do. It keeps them occupied for hours on end as well, which is great.
With various creative books, Hero in My Hood aims to educate children about COVID-19 by educating them on the importance of keeping your hands clean and wearing masks in a fun, adventureful way.
We actually started by doing let me show you the first one that we did. We did this one. This is a handout that is a free download off our website, so anyone can download it, print it out, color it in, and go through the messages. And it tells the kids step by step a little bit about what COVID is. And our aim is not to scare them, because the kids are terrified. They don't know what's going on. They've got mom and dad that are hucking at each other because they're uncertain. So just calm the kids down, give them something nice to do. And this is quite calming, and it's got positive messages. So it tells them, what you can do is you can keep your hands clean by washing with soap, because soap's going to kill this little thing. What you can do is you can wear a mask. It's what you can do, not what you can't do. So we're trying to empower the kids and make them feel powerful and that they can actually do something, that they can become the heroes of their neighborhood by doing something. So after we did this one, which was approved by the health department, been used by the health department, we did our next one, which was hand washing, which looks like that. That is also a free download off our website, so anyone can download it. They can print as many copies as they like, hand it out to the kids, get the kids occupied. And you know, when the kids are busy, then they don't get under mom and dad's feet. And if mom and dad are struggling with the anxieties that everybody's going through at the moment, it's nice to know that the kids are occupied and they're not irritating you. So this again tells the kids what to do. It tells them the positive steps about what to do. It doesn't say don't do this, don't do that, go away, you're irritating me. It says, you know, get involved, do something nice, color it in. And then we did another one on masks. So it's also just how to put your mask on, how to look after it, and how to keep yourself safe that way. So that is how we're contributing by doing these free downloads. And what we've also done is we've got involved with the Butterfly Art Project. And what they're doing is they're going out to a number of organizations in the Cape Town area, and they're delivering our books plus a whole art kit. So the kids have got the art materials and they've got the books.
In partnership with the Butterfly Project, they aim to donate books around Cape Town in areas like Lavender Hill and Manenberg in efforts to educate children.
So we're partnering with them to get books to them, and we have a little competition on our website where people can do a ball. It's got our characters on it, and they can create a ball, and by creating a ball and sending in a photograph of it to our website, we will then donate more books. We'll see what donations we can find to give more books to the Butterfly Art Project.
You can get involved by donating books to the organization and going on their website to help children uplift and become heroes in their community.
I've wrote this out for you just to make it easier. That's our website, heroinmyhood.co.za. You can check it out also on our Facebook page, and there are all sorts of ways you can get involved. Download these free apps, these free handouts for the kids. That's a start. And then what you can also do is you'll see that in the download page, there's a little button that says, if you've liked this, sponsor a book for 10 Rand. Just click on that. Or you can sponsor a book for 10 Rand. You can sponsor a book for 20 Rand. You can sponsor for 50 Rand. That's 5 books. Even 100 Rand. That's 10 books to 10 children that will then get extra education. And they will have something to do that's fun and engaging and empowering.
For Our City News, I am Stephanie Pitt.
With the country being on lockdown for 2 months, business has also been on lockdown for 6 workers as they are unable to work due to COVID-19. Sweet and Asijiki, an organization that advocates for rights of sex workers, said that the pandemic has had a negative impact on business. President Cyril Ramaphosa has announced that the country will officially move to level 3 lockdown on the 1st of June. He also warned that some places could go back to level 4 or 5, depending on whether citizens and businesses adhere to regulation. He identified Johannesburg, eKurhuleni and eThekwini, Nelson Mandela Bay, Buffalo City and Cape Town has COVID-19 hotspots. On this level, alcohol will be sold for home consumption and would be on sale on some days during certain hours, and more sectors of the economy will open.
While the nationwide lockdown has been effective, it cannot be sustained indefinitely. We introduced the 5-level COVID-19 alert system to manage the gradual easing of the lockdown. This risk-adjusted approach is guided by several criteria, including the level of infections and the rate of transmission, the capacity of our health facilities, the extent of the implementation of public health interventions, and the economic and social impact of continued restrictions. It is on the basis of these criteria and the following consultation that Cabinet has determined that the alert level for the whole country should be lowered from level 4 to level 3, with effect from the 1st of June 2020. Moving to alert level 3 marks a significant shift in our approach to the pandemic. This will result in the opening up of the economy and the removal of a number of restrictions on the movement of people, while significantly expanding and intensifying our public health interventions. Even as we move to alert level 3, it is important that we should be aware that there are a few parts of our country where the disease is concentrated and where infections continue to rise. We will have what we call a differentiated approach to deal with these areas that have far higher levels of infection and transmission. These areas will be declared coronavirus hotspots. A hotspot is defined as an area that has more than 5 infected people per 100,000 people, or where new infections are increasing at a very fast pace. The following metros in our country have been identified as coronavirus hotspots: Tshwane, Johannesburg, eKurhuleni, eThekwini, Nelson Mandela Bay, Buffalo City, and Cape Town. There are other areas that are also hotspots, and they being West Coast, Overberg, and Cape Winelands district municipalities in the Western Cape, Chris Hani district in the Eastern Cape, and Ilembe district in KwaZulu-Natal. We are particularly concerned about the situation in the city of Cape Town and in the Western Cape generally, which now has more than half the total infections in the country. We are attending to this as a matter of urgency. The list of hotspot areas will be reviewed every 2 weeks, depending on the progression of the virus. In dealing with the virus in these areas, we will implement intensive interventions aimed at decreasing the number of new infections. We're putting in place enhanced measures of surveillance, infection control, and management. We will assign a full-time team of experienced personnel to each of these hotspots. This team will include epidemiologists, family practitioners, nurses, community health workers, public health experts, and emergency medical services, and these will be supported by the Cuban doctors who are experts. We will link each hotspot to testing services, isolation facilities, quarantine facilities, treatment, hospital beds, and contact tracing. Should it be necessary, any part of the country could be returned to alert levels 4 or 5 if the spread of infection is not contained despite our interventions, and that where we see that there is a risk of our health facilities being overwhelmed. In time, however, through our efforts, it will be possible, and we are aiming for this, to place areas where infections are low on levels 2 and 1. The implementation of alert level 3 from the beginning of June will involve the return to operation of most sectors of our economy, subject to the observance of strict health protocols and social distancing rules. The opening of the economy and other activities means that more public servants will also be required to go back to work. This will be done in accordance with provisions of the Occupational Health and Safety Act and as guided by the Department of Public Service and Administration, working together with all government departments. We appreciate the work that continues to be done by public servants, especially those who are in the front line in the fight against COVID-19. The safety of all workers, including public servants, is a matter of concern to us. We will continue to make all efforts for the adequate provision of personal protection equipment to ensure safety for everyone while at work. Our priority is to reduce the opportunities for the transmission of the virus and create a safe environment for everyone. We're therefore asking that those who do not need to go to work or to go to an educational institution continue to stay at home. People will also be able to leave their homes to buy goods or obtain services, including medical health care. People will also be able, in this level 3, to be able to exercise at any time during the day, provided this is not done in groups. The curfew and the movement of people will be lifted. Alcohol will be sold for home consumption only under strict conditions on specified days and for limited hours. Announcements in this regard will be made once we have concluded discussions with the sector on the various conditions. The sale of tobacco products will remain prohibited in alert level 3 due to the health risks associated with smoking. All gatherings will remain prohibited except for funerals with no more than 50 people or meetings in the workplace for work purposes. Any place open to the public where cultural, sporting, entertainment, recreational, exhibitional, organizational, or similar activities may take place will remain closed.
Well, that's all from the news front. When we come back, Stephanie Pitt will be reading your comments on what you thought about President Cyril Ramaphosa's speech and what's trending on Twitter today. Stay with us.
Welcome back, I'm Stephanie Pitt. With the country being on lockdown for 2 months, business has also been on lockdown for sex workers as they are unable to work due to COVID-19. Sweat and Asijiki, an organization that advocates for the rights of sex workers, said that the pandemic has had a negative impact on business.
Sex Workers Education and Advocacy Task Force, which is known as SWET and Asijiki, is an organization that advocates for sex workers, says that the lockdown has had a negative impact on sex workers, which has made business very difficult for them.
My name is Constance Natando-Mate from Asijiki, the Coalition for the Decriminalization of Sex Work. I will study from the sex workers' perspective right now in the current situation of the pandemic. It have affected the sex workers because, as we know, that sex worker in South Africa is not decriminalized, is still criminalized. Therefore, it's not recognized as an occupation, so that have affected the sex workers. They cannot benefit from any income from the government or any the UIF, for example, and also the taxes, so they don't get any income and they can't generate any income. We have tried as much as we can, as you perhaps you have visited our website, Asijiki and Sweat and Sisonke website. We have tried our best to do the fundraising during this. We are surviving through the donations, which is not enough because in our fundings we didn't have money specifically allocated for this issue. We just launched a NERUM report recently. We have over 2,000 sex workers that have been abused and they've been killed from 2019 to 2020, within a year period. To just clear that it have raised a million times in the media. We don't want sex workers don't want to be the essential workers because they are already marginalized. They belong from the marginalized group. So they don't want to be essential workers. So as Sweat and Sisonke as an organization, we have been trying to raise that issue. They need to separate the issue because we don't see the sex workers being essential workers, while they are criminalized.
The organization Asijiki says that sex workers will not be part of essential workers as they've already been marginalized in society. For our City News, I'm Zanele Mvana, Observatory.
Now let's take a look at the popular hashtags on Twitter today. Hashtag Africa Day. How much we love Africa is revealed today on Twitter as South Africans from south to north, east to west celebrate the continent. Eid Mubarak. Muslims around the world are celebrating Eid today, many in lockdown conditions. And here in Cape Town, it seems like it's the start to the winter rains as well. After the ad break, Michaela Miller will be sharing important information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. You can also call us on 0211 480 448. From me, Michaela Miller, and the Our City News crew, enjoy the weekend. Goodbye. We leave you with this beautiful rendition of the African Union Anthem. Enjoy.